Extract 1, questions 1 through 12. You hear a physician talking to a new patient called Bernardito. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, doctor. I am Bernardito.
Good afternoon. May I know what your problem is?
I am having a severe stomach ache.
What do you feel?
I have heartburn and severe pain, doctor.
Since when have you been feeling this acidity and pain?
For the past 2 months, my stomach hurts after every meal. The pain persists even during nights.
Have you eaten any heavy food or something different in the last 2 months?
No, actually.
How severe is the pain? Let's say on a scale of 1 to 10, how would you scale the severity of the pain?
Well, I can say between 4 to 5.
Is the pain continuous?
No, it hurts only fleetingly.
Do you feel the pain after meals?
Yeah, probably because it hurts every time after I eat.
Is there any kind of food that bothers you much?
Yeah, greasy food.
Oh, I see.
Yes, at home we eat a lot of greasy food.
Where in the abdomen does it hurt? Tell me the exact point. Does the pain shift to your chest, shoulder, back, or across your abdomen?
It hurts in the middle. At times the pain moves across my abdomen.
Besides the pain, you said you have heartburn?
Yes, I feel a kind of sour taste whenever I burp.
Do you feel like this more during the day or in the evenings?
Both. I feel the acidity during the day and at night.
Is it getting worse whenever you lie down?
Yeah, I get an acid-like taste in my mouth.
Besides greasy food, are you getting some irritation in your stomach when you eat any other kind of food, like spicy food?
No, actually, we don't eat spicy food at home.
And tell me, how frequently do you have a bowel movement?
No, it hasn't changed. It's regular.
And tell me, how frequently do you have a bowel movement? And has there been any change in your bowel movements for the past 2 months?
Yes, it has become a little bit softer.
Is there any change in the color?
Yeah, it is greener.
Greener and not darker? Any blood in your bowel movement, or is it darker?
Not darker. And there wasn't any blood in my bowel movement.
Okay, let's first diagnose your abdomen to check from where the pain comes. You said you are feeling pain at the middle part of your abdomen.
Correct.
Does the pain stay there only, or does it move somewhere else?
It usually stays there.
Do you feel acidity and heartburn during the pain?
Yeah, you were right.
Do you have vomiting or nausea?
No, not now.
What did you eat today?
I ate meat and tomato sauce.
Do tomatoes give you any trouble?
Not exactly. I have been eating tomato sauce always.
Do you get any trouble when you have orange juice?
Yeah, at times.
How do you feel then?
I get a strange metallic taste.
You do not feel acidity then?
No?
Now, tell me, what do you do whenever you get stomach aches?
I take Alka-Seltzer at times. That gives me a relief from the pain to some extent.
Yeah, that should help with the relief. Do you take any Maalox, Tums, or Mylanta?
No.
Have you ever taken any medication on a consistent basis such as Advil, aspirin, or Motrin?
I was taking Tylenol usually.
Okay, as I told you earlier, I'm going to examine your feces to investigate whether you have any kind of parasite. Tell me, do you either come from the tropics, or have you ever been traveling to any of the tropical regions or overseas?
Yeah.
Parasites that are found in most of the parts of the world affect the stomach. Besides, I want to check for any occult blood. You have mentioned earlier you haven't seen any changes in your feces, and it's only greener and not darker. Sometimes, if you have a hemorrhage in your stomach, then the digested blood could produce a chemical reaction so that you can have occult blood in your feces. In such cases, we don't see the red color or dark color of the digested blood. Therefore, a diagnosis is essential. Moreover, I would like to diagnose your upper gastrointestinal system through x-rays and contrast. You will be given a thick substance to drink, and then the radiologist would observe how your liver digests the substance and observe your stomach movements. Because I think that your pain comes from your gallbladder and not from your stomach, I will have to do this kind of diagnosis. After a thorough investigation, let me decide whether I should take the x-ray test or an ultrasonic study of your gallbladder. Do not eat any greasy food for now, and also do not have your dinner just before going to bed, because it could produce more acidity. Eat normal food and nothing spicy. I shall get back to you as I receive your medical reports from our lab. Anything else?
With so many medical tests, I'm afraid I have an ulcer.
I too have that kind of doubt. That is why I have suggested all these tests. I need to explain to you that an ulcer or other irritations in your upper intestines cannot be detected by x-ray at times. If the pain continues after having some antibiotics, you may have to go for an endoscopy. An endoscopy is a medical investigation in which a tube will be inserted through your mouth or nose, and then the specialist will observe your stomach, from the small intestines to the large one, and your gullet. Do you need any clarification?
No, doctor, thank you.
Good. Let us meet next week. Goodbye.
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Mr. Gregorius. For questions 13 to 24, complete the following notes with a word or short pause. You now have 30 seconds to look at the notes.
Hello, doctor.
Yes, come in. What's your problem?
Well, he is my husband, and he had a markedly abnormal stress test with severe chest pain after 5 minutes of exercise on the standard Bruce with horizontal ST depressions and moderate apical ischemia on stress imaging only.
What's his name?
He is Mr. Gregorius.
What is his age?
55, doctor.
Well, his cardiac catheterization today shows mild to moderate left main distal disease of 30%, moderate proximal left anterior descending coronary artery with a severe mid-left anterior descending coronary artery lesion of 99%, and a mid-left circumflex lesion of 80% with normal left ventricle function and some mild luminal irregularities in the right coronary artery with some moderate stenosis seen in the mid to distal right patent ductus arteriosus. He shows rest anginal symptoms, as well as nocturnal angina symptoms, and especially given the severity of the mid-left anterior descending lesion with a markedly abnormal stress test. I am prescribing him aspirin 325 milligrams once a day, Nexium 40 milligrams once a day, Zocor 40 milligrams once a day. Plavix 600 milligrams, which I am giving him tonight. I would suggest that you transfer him for percutaneous coronary intervention.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a physician explaining about the use of thimerosal in vaccines.
Thimerosal is a mercury-based preservative that has been used for many decades in the US in multi-dose vials of medicines and vaccines. There is no significant evidence of side effects caused by the mild doses of thimerosal in vaccines, except for minor reactions such as redness and swelling at the injected site. However, during 1999, the Public Health Service agencies, the American Academy of Pediatrics, and vaccine manufacturers agreed to reduce or eliminate thimerosal usage in vaccines as a precautionary measure. Methylmercury is obtained from certain kinds of fish. A high exposure to methylmercury can be toxic to people. However, over a lifetime, everybody is exposed to some methylmercury. Thimerosal contains ethylmercury, which is the most widely used form of organic mercury that is cleared from our body more quickly than methylmercury and is likely to cause any harm to the individuals.
Question 26. You hear a discussion between a doctor and nurse about bronchodilators used to treat chronic obstructive pulmonary disease. Now read the question.
Hello, doctor. What are the different types of bronchodilators used to treat chronic obstructive pulmonary disease?
Patients with chronic obstructive pulmonary disease are often prescribed a bronchodilator, a type of medication for relaxing the air passages to help breathe better. Typically, the medications are inhaled through the mouth using a metered dose inhaler, but also come in liquid, pill, injectable or suppository formulations. The 3 classes of bronchodilators commonly used to treat chronic obstructive pulmonary disease are beta-adrenergic, beta-agonists, anticholinergics, methylxanthines. Beta-adrenergic agonists are a type of medication that bind to specific receptors in the lung called beta-adrenoceptors. By doing so, they block the trigger to bronchial spasms and allow airway passages to open. Beta-agonists can either be short-acting or long-acting, which are delivered either orally or through a metered dose inhaler. Generally, the inhaled method is preferred as it alleviates symptoms faster. Anticholinergic blocks the neurotransmitter acetylcholine in the central and the peripheral nervous system to its receptor in nerve cells and inhibit parasympathetic nerve impulses. Methylxanthines affect not only the airways but stimulate heart rate, force of contraction, and cardiac arrhythmias at high concentrations.
Question 27. You hear a doctor explaining to the nurses about the growth hormone test. Now read the question.
Growth hormone test.
The growth hormone is very essential for the human body to grow. To find out why the growth of a child is slow, a growth hormone test called arginine and clonidine stimulation test is performed that will indicate the secretion level of growth hormone in the body. The child will be injected with 2 types of medicines during this test, namely arginine and clonidine, that will cause the body to secrete the growth hormone. Biochemically, the growth hormone reserve of the child is defined by the peak serum concentration after stimulation with a known secretagogue. While performing the test, nurses draw 5 blood samples at specific intervals to observe how many growth hormones the body is secreting. Prior to the test, the child should not be allowed to eat or drink anything except water after midnight. The test takes about 6 hours, so the child should be clothed comfortably. Generally, a short-sleeved shirt is suggested during the test. The nurse on duty should make sure whether the child is on any medications before scheduling this test, and they should explain to the parents of the child about the process and outcome of this test. The test will be performed in an endocrinology outpatient clinic, and the nurse should measure the weight and height of the child. Then the child will be taken into the patient room equipped with the intravenous catheter, which is used to inject the arginine into the child and to take the blood samples. However, the clonidine will be fed through the mouth in liquid or in pill form. This may lower the blood pressure and cause the child to sleep, so the nurses should keep on measuring the blood pressure of the child during various intervals. The child may be given fluids to drink during the test. However, before discharging from the clinic, the child should be able to eat and walk around. The child may feel tiresome throughout the evening.
Question 28. You hear a senior nurse giving feedback to a trainee after a training exercise. Now read the question.
Okay, that went quite well, didn't it? But it took you a while to work out where the CPR board was kept.
Yeah.
So, what does that tell you about this scenario?
We need to check where things are before doing anything else.
Exactly. And of course, it takes a second or two to put the head of the bed down, because you've got to have that part of the bed flat before you slip the board in. I wish there was a quicker way.
So, do I put the CPR board under, or would I normally hand it over to somebody else?
It makes no difference as long as it's done.
Question 29. You hear a discussion between a doctor and a nurse on leukopenia disease. Now read the question.
Hello, doctor. Can you explain to me what is leukopenia disease?
Well, leukopenia is a condition where the patient has lesser white blood cells in their bloodstream, which is diagnosed with a blood test called a complete blood count. There are 5 types of white blood cells, and each of them protects the body from a different kind of infection. Neutrophils make up 55 to 70% of total white blood cells, and they fight off fungal and bacterial infections. Lymphocytes protect the body from viral infections. Monocytes are the largest of the white blood cells, and they fight against bacteria, fungi, and viruses, and they mend tissue damaged by inflammation. Basophils are involved in inflammatory reactions to allergens. Eosinophils fight parasites and play a role in allergic reactions and conditions, such as asthma.
Question 30. You hear a discussion between a nurse and a doctor on Crohn's disease. Now read the question.
Hello, doctor. What are the different types of Crohn's diseases?
Well, Crohn's disease is a chronic, incurable disease that can cause inflammation anywhere along the digestive tract. Crohn's disease is characterized by symptoms of abdominal pain, diarrhea, cramping, weight loss, bloating, and blood in stools. Crohn's disease affects people differently, mainly due to the different types of the disease and the areas they affect. The most common types of Crohn's disease are ileocolitis that affects the colon and adjacent ileum, jejunalitis affects the jejunum, ileitis affects the ileum, Crohn's granulomatous affects the colon, gastroduodenal Crohn's disease affects the stomach and adjacent duodenum.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36. You hear the lecture given by a physician on the standard method of diagnosing attention deficit hyperactivity disorder. You have 90 seconds to read questions 31 to 36. The standard methods of diagnosing and assessing attention deficit hyperactivity disorder used by mental health professionals is application of the criteria established in the Diagnostic and Statistical Manual for Mental Disorders that identifies 3 presentations of attention deficit hyperactivity disorder: combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. Functional neuroimaging, such as SPECT scanning, is considered an effective tool for researchers. Type 1. Classic attention deficit disorder. People with classic attention deficit disorder have reduced blood flow in their brain area of the prefrontal cortex, cerebellum, and basal ganglia. The basal ganglia produces dopamine. Type 2. Inattentive attention deficit disorder. People with inattentive attention deficit disorder are often described as daydreamers, space cadets, and couch potatoes. This type is more common in girls than boys and is often diagnosed later in life because people with type 2 inattentive attention disorder don't have behavioral problems. People with this disorder have reduced activity in the prefrontal cortex as well as low levels of dopamine. Type 3. Over-focused attention deficit disorder. People with over-focused attention deficit disorder have a deficiency of dopamine and serotonin. The aim of treatment is to increase both these neurotransmitters, the nervous system's chemical messengers. Type 4. Temporal lobe attention deficit disorder. People with this type might see or hear things that are not there, and learning and memory problems may be present. The patients will have irregularities in their temporal lobes and less activity in the prefrontal cortex part of the brain. The aim of treatment is to soothe neuronal activity and stop nerve cells from overfiring or firing unpredictably. Type 5. Limbic attention deficit disorder. People with limbic attention deficit disorder have excessive activity in the limbic section of the brain, which is where moods are controlled. They have reduced activity in the prefrontal cortex, both when relaxing or focusing on a task. Type 6. Ring of fire attention deficit disorder. People with ring of fire attention deficit disorder have an overactive brain. There are excessive amounts of activity in the central cortex and other areas of the brain. Type 7. Anxious attention deficit disorder. People with anxious attention deficit disorder have high levels of activity in the basal ganglia that aid in making dopamine. This differs from the majority of the other attention deficit disorder types, which have low activity in this part of the brain. It is possible to have more than one of these types of attention deficit disorder. For example, a common combination is overfocused, limbic, and anxious types.
Now look at Extract 2, questions 37 to 42. You hear the discussion of a physician with junior doctors on refractive error. You have 90 seconds to read questions 37 to 42.
Hello, doctor. What is refractive error and what are the types of refractive error?
Well, a refractive disorder is an ocular condition caused by changes in the eye shape that prevents light from being focused sharply on the retina, creating vague images. The causes may range from congenital shortening or lengthening of the eyeball through variations in the shape of the cornea to anomalies of the lens. During the process of refraction, the light bends when passing through the cornea and the lens. This helps direct light from the objects we view exactly on the macula, the part of the retina that has the maximum number of cone cells, which are the photoreceptors responsible for detailed and sharp vision. Myopia or short-sightedness happens when the eye refracts light so much that the rays converge to a spot in the front of the retina, leading to a blurred image when one looks at objects that are beyond a certain distance. However, objects that are close can be seen clearly, as the light rays are divergent at their origin, and so undergo the right amount of refraction. The eyeball in such people may be too long, or the cornea may be bulged more than usual, leading to the focusing of light before it reaches the retina. The condition is usually diagnosed in childhood, between 8 and 12 years. It stabilizes in the years between 20 and 40 in most cases. A family history of myopia may predispose to the condition. It is correctable using prescription eyeglasses, contact lenses, or refractive surgery such as keratoplasty. People with high myopia have a greater risk of future retinal detachment. Hypermotropia is also called long-sightedness, that occurs when light rays reflect too little and so focus beyond the retina, leading to poor vision for near objects. However, light from more distant objects is parallel, and so usually comes to a focus at the retina with this lower level of refraction. Some hyperopic people cannot see well regardless of the distance of the object. The eyeball may be shorter, or the cornea flatter than usual, or the lens may have less refractive power than is normal. Like myopia, eyeglasses, contact lenses, or surgery may be recommended for correction. Astigmatism is a condition in which the shape of the cornea is uneven. For example, it may be curved more in one direction than the other, or show areas where different curvatures. As a result, light rays are scattered and come to focus at different spots on the retina rather than forming a single sharp image. This leads to blurry vision. Eyeglasses are usually recommended, but contact lenses to smooth the refractive surface and refractive surgery to chisel the cornea to a smooth contour may also work well. Presbyopia is a refractive error caused due to aging. As the lens inside the eye ages, it loses its power to change shape, with the pull of the ciliary muscles in response to the need for greater or less refractive capability. As a result, it becomes less able to accommodate itself, so as to focus light from nearby objects clearly. Near vision becomes a problem, leading to the characteristic picture of people over the age of 35 or 40 holding books farther away than usually in order to see them clearly. Eyeglasses are the best way to correct presbyopia. Bifocal glasses have two different refractive powers, with the lower part being designed for reading and the upper part designed for distant vision. This is the end of Part C. You now have 2 minutes to check your answers.